Since 2019, CIDRZ has been implementing the Key Populations Investment Fund program nested within the Achieve program. And the objective of the Key Populations Investment Fund program is to improve access to HIV services among key populations. And these key population groups are men who have sex with men, female sex workers, transgender persons, as well as people who inject drugs. And this program has been implemented in line with the Zambia National AIDS Strategic Framework, which actually calls for concerted efforts to address the HIV epidemic among key population groups. And so since 2019, we've reached over 5,000 key populations with HIV prevention services, some of whom have been put on either PrEP if they are HIV negative, and on antiretroviral treatment if they are HIV positive. And in addition to that, we've also provided HIV prevention services during this period. This includes distribution of condoms and lubricants. And since 2019, for instance, we've distributed over 100,000 condoms to key populations, as well as over 70,000 lubricants. And we've done this in order to support government efforts aimed at addressing the HIV epidemic in the country. You may wish to note that the burden of HIV among key populations is very high compared to people in the general population. And our program has actually demonstrated that the burden of HIV is very high among key populations. For instance, among female sex workers, the HIV prevalence ranges between 30 and 50%. And among men who have sex with men, the HIV prevalence has ranged between 20 and 30%. Among people who inject drugs, on average, 21% of those who've tested have actually been found positive and initiated on treatment. So what we've done through the Achieve program, and more specifically through the Key Populations Investment Fund program, is to actually demonstrate that it's feasible and that it is important to reach key populations with HIV services if Zambia is to effectively control the HIV epidemic.
There's a facility which was created away from this facility for the key population, which we've seen that it's really working well in terms of people have really found it nicely to go there to get services such as sexual workers, KPs. We've seen that even the numbers have gone high because they are not mixing with any other person here. So from that facility which was opened, it has really helped us as the CIDRZ.
There are a number of challenges really that we've encountered in the implementation of the program. As you may wish to note, we live in a legally restrictive as well as socially conservative environment. But what we've done is to adopt a public health approach, simply because if we don't address the HIV epidemic among key populations, it will be very, very important for the country to actually address the HIV epidemic effectively in the country. So despite all these challenges that we've encountered, including the high movement of key populations from one location to the other, what we've done is to actually demonstrate that, yes, it is important to reach out to key populations with HIV services as a way of effectively controlling the epidemic. Lessons learned really are that, one, key populations programming, of course, is time-consuming. It's also very sensitive, given the socially conservative environment that we live in. But what we've learned is that when you adopt a public health approach, it is actually easy for key populations to come forth to access services. And what we've also learned is that program implementation should not be done in isolation. Once you engage government institutions, government structures, it's actually very easy to successfully implement key populations programs as a way of reaching everyone with health services.